This is our bi-monthly meeting of the National Tribal Resilience Data Work Group. I think more folks are going to stream in, but it's the first time we have met in 2 months, where it was a much different scene for the issue of tribal climate data access. I feel like those 3 words are challenging, more challenging right now than perhaps before. We're going to spend a little bit of time later on in the agenda talking a little bit about what y'all are experiencing in terms of data access. So we'll talk about it. How is everyone? Is everybody just going to go off camera today and hunker down? Oh, good. Susanna, thank you for getting on camera. Hi, Chris. A thumbs up will do. I'm doing a wellness check. Blink if you're okay.
Now, isn't it supposed to be blink if you're not okay? Like blink if you need us, to send help.
Colleen is all about the thumbs ups. She's good. Hi, everybody. All right, Ben. Hey, I'm happy to see you, buddy. Okay. Well, y'all can see my screen, right?
Yep.
Let's talk about what we're going to talk about today. Most of you have been here plenty. I see maybe a couple new faces. I'm going to invite everybody to introduce yourself over chat. And then for those folks, if this is your first meeting, we're going to ask you just to say hello out loud in just a minute, once I just kind of remind us all what we're here to do. So we've been at this for 30 meetings, which is over 3 years. We usually get together every couple of months to connect national health and climate data experts and invite everybody to exchange knowledge on priority tribal adaptation and resilience data needs. We share tools, practices, ideas, and lessons learned from the field, and we explore opportunities to develop and scale up solutions to address tribal resilience data, which is why today we have a speaker who fits right into that. Walker Weiland with OEHHA is here to share with us his first iteration of a tool called Cal Heat Score. So we get to chew on that a little bit. We'll spend a little time in a demo, right, Walker? And then we'll do some Q&A and discussion, and everybody can share, feedback, early feedback. And I think, Walker, you're just at the beginning of your tour, your road show with this tool, trying to make it, see what you can do to make it as good as it can be, right?
That's right. I've barely even started, so plenty of room for feedback and input that we can incorporate right in.
Well, Walker, I think you've been in these meetings before, but this is like the brain trust when it comes to tribal climate health data.
That's why I'm so happy to be here.
Yeah. Well, great. So let's see. Are you all introducing yourselves over chat? Susanna, I think this might be your first meeting. Am I right about that? Would you mind introducing yourself? Just tell us a little bit about the role that you're playing.
Happy to. Good morning, everybody. Thank you for having us. I am a research scientist on Walker's team, helping to develop and communicate about our new Cal Heat Score tool that I'll be introducing.
Lovely to have you. Normally we have Lori Monster out here, a former OEHHA person who is helping me facilitate these meetings now, but it's always nice to have OEHHA here. I see so many OEHHA folk. Felicia and Brooke, you brought the whole team.
We did.
You want to say hello, Felicia and Brooke?
Yeah. Hi, everyone. It's great to meet everyone. My name's Felicia Chong. I'm a climate scientist working in Walker's Extreme Heat Group, and I'm located in Oakland.
Great. And Brooke.
Hi, everyone. I'm Brooke. Well, you can hear me. My headphones have been acting up. I'm Brooke Bell. I am a research scientist also working on the Cal Heat Score team.
Okay, let's see. Do I see anybody? Chassa, do you see anybody else new here?
No.
Think so.
No, I don't think so. And I haven't been on in a while, so it's great to be back. So I should probably reintroduce myself to folks who haven't met me. I'm Shasta Gaughan. I am the environmental director and also the tribal historic preservation officer for the Paula Band of Mission Indians, and the director, but I think more like co-director with Angie of the Tribal Climate Health Project.
Yeah, I didn't introduce myself either. So that's who I am, working under Shasta. And all right, so I think what we'll do first is what we always do, which is go into some member updates and announcements. This is a time for all of us to kind of help each other get up to speed on what's the latest in this field. So anything relevant to your fellow National Tribal Resilient Data Work Group members, that might look like something related to tribes, climate change, health, and data. So opportunities for comment or advising, or maybe you have a new thing coming out. What are you working on? Let's get caught up.
Well, I'm going to mention something because all these OEHHA folks are here, and I don't know how much crossover all of y'all have with your different initiatives, but I'm working with Annika from your office on updating the Paula's contribution to the tribal health indicators, tribal climate health indicators report, and we had submitted to that in I think 22, I want to say 23. It was during COVID time, and that time has no meaning. And I worked with Lori on that very closely. And, since Lori has now moved on to doing some work for us as a consultant, which is amazing. But I'm working with Annika and really looking forward to getting that updated and out there, especially now when we need the word out from California as much as we possibly can, since California is going to be one of the states that's going to continue doing this climate work. And we don't know that that's the case in a lot of other places. And, unfortunately, a lot of my tribal colleagues work in red states. Their reservation lands are in red states. And so they are definitely affected by a lack of access. And that would actually be my question. If anybody has any insights on the ability to access data from federal agencies that might be relevant to this work that we're doing. Are you able to get to it? Are you not able to get to it? Are things disappearing? Are they coming back? Thoughts? Horror stories?
We've been noticing stuff. I'm with the County of San Diego. I'm an epidemiologist there, and I work on a lot of things that may or may not be related to Charlotte and climate change. But yeah, we are noticing that a number of climate pages at not all of them, the CDC, or other things that are strangely, you wouldn't even think they were connected, and boom, there, we can't find them anymore. Data sources relating to particular conditions. That's more probably related to some of the other editing that they're doing there. So yeah, we're definitely noticing.
Oh, thanks, Isabel. And just from a broader health perspective too, I think it's just something to keep our eyes on, that we've got a new set of folks with some, shall we say, unusual points of view in health and human services. And that may end up having a trickle-down effect into some of the work that we're doing in climate and health. Walker, hand up, like it.
Yeah, so it's something that that we've been tracking, and our Cal and VirusScreen colleagues at OEHHA have been tracking as well, blocking access to data sets, to tools that are out there. For example, for certain periods of time, EJ Screen and the CDC's EJI were taken down. They may have come back up. There's sort of an influx and consistencies. I want to drop a couple of resources in the chat. One is the Harvard Law Library. So they have undertaken an initiative to basically preserve climate and EJ and other data sets and other government websites that have been or are in danger of going away. There is also a website that was spun up to archive screening tools it's literally called screeningtools.com. So that would contain, for example, the climate and economic justice screening tool that was developed by the former administration and an EJ Screen. So those are a couple things we've noticed, but also a couple of resources that are still available to folks, and I'll put them in the chat.
Angie, I didn't realize you had this on your slides, so.
It's all right. It's what needs. It's what's naturally blossoming. So we could just cover it now because I feel like folks want to go there. I can share too, just on that note. You know, you all know we have our Easy tool, and we're using it right now to provide data to our tribal advisors across California, of which there are 11. So 11 folks from federally recognized tribes are participating in this. Part of what they get in return for participating in our advisory group is a whole heap of data, which basically looks like us using our Easy tool to grab all the publicly accessible climate, resilience, and health related data that we can for them, so they don't have to go do it on their own. And in that process, it's really Lori that's doing a lot of that heavy lifting, and she isn't finding that a lot of things are missing yet. I was just talking to her about it. A lot of stuff that we rely on typically is still there. Some of it's state-based, great. One of our favorite tools, CDC's National Environmental Public Health Tracking, is apparently most of it's still up and available. But I will let you know, like that, it's like that's the front line where we're really going to know when we start hitting roadblocks in the data sets, and we'll bring that back to folks. So I wanted to just give you all that update.
And thanks for the stuff that folks are putting in the chat. And since you brought up environmental justice, I also want to point something out that is important for tribes, and it's just, I think, useful for you all to know, which is that many tribes and tribal organizations have put forth to the administration that tribes do not fall under environmental justice, nor do they fall under DEI initiatives. And for a lot of tribes, there was a big fear of that, because we are, you know, for me as somebody who works for a tribe, and certainly tribal leaders and citizens are having to explain that there is that federal trust responsibility between the government and the tribes, and that is a political relationship. Tribes are nations, so the definition of tribe is not an ethnicity or a racial definition, and it's not environmental justice in the same way as other EJ communities, which is not to say that tribes don't have environmental justice concerns, but the way that we are able to work on those issues with the federal government is different than other communities because of that sovereignty and trust relationship between the tribes and the federal government. So far, the federal response has been, yes, we understand the nature of sovereignty and the government to government relationship. So we are not including tribes under our attacks. They don't say attacks, I'll just use that word, on DEI and their avoidance of environmental justice issues and responsibilities. So we're okay for now, but who knows? So just something to keep in mind if you're doing work with tribes.
Curious if anyone else has some experiences to share here. Are you having trouble accessing data? Are you trying to compensate for that, maybe in some of the agencies?
I know at the California EPA, we started to, well, from the water board's perspective, collect what we're concerned about might go missing. I'm not sure what's happening at the Cal EPA level, so we sent all that to Cal EPA, so we'll see.
Thanks, Chris. You must have felt my eyes on you. I was hoping you would say something. I just dropped this in the chat. This is, so Shasta's been coming to my huddles. I hold a huddle every couple of weeks on California energy and climate federal developments, trying to compile some stuff that's ideally useful for people. And a lot of it has been on the funding freeze, but there is this in this document down here. There's a whole section on data and tool resources that a friend of mine in the biz has been trying to compile. So I just want to make sure y'all had access to this. This is where some folks are trying to archive and collect some data. So just know that this is one source. I don't think it's the only one out there. If you know of others, I would love to be able to add it to my list here because I'm just sharing this all over California. So link it up in the chat if you know of other things that should be added, or I'm just telling everybody, add directly to this document if you'd like. Oh yeah, you're welcome. We're sort of we have to be in community here right now and help each other out.
Yeah.
Anybody else want to share here? I'm going to go back to my slide. Any other announcements? Doesn't have to be federal related. Actually, there is one more thing. I'm told I can read something out loud, but I probably shouldn't record it. So hang on. All right. Any other updates before we dive in? Hey, Shasta, do you want to talk a little bit about Tribal Climate Health Project's webinars that are coming out, or I can talk a little bit about it?
Yes, we have webinars coming out. I don't remember details.
Yeah.
Do we have a date yet? I don't know if we have a date, but we're going to be doing these every other month. Are we focusing on heat for these? Angie, you tell people, please.
So we have grant funding, thank goodness. We seem to be able to draw on it right now. It's BIA Tribal Resilience Grant funding, like our usual funding is, and it's allowing us to do a webinar series, which we've done a lot in the past. This one will be a six-time series, so one every other month for over the course of the next year, starting in late April. At the time, we were thinking we wanted to do sort of like, how do we talk outside of the climate choir about climate resilience? How do we bring other people into the fold in terms of tribal adaptation and protecting health? And so we're still sticking on that. And I kind of think it's become even more important to think about what are the other fields and more institutionalized fields outside of climate that we can still continue this work. And so that's what we're going to do. We'll have our outreach starting probably next week and maybe looking to some of you to be speakers in that series. It's being done as a collaborative series alongside of TEC, which is Tribal Energy and Climate Collaborative, Southern California Regional Climate Collaborative, also headed by Shasta. And so we're sort of partnering up to bring this series to all California tribes. So Walker, it might be another opportunity for you to come speak at something sometime soon. Okay, that's a lot of updates. I always like when we get together. Let's go ahead. I'm going to turn it over to you, Walker. I made you co-host in case you want to share your screen, but thanks for doing this and being here on short notice. We're excited to hear about the Cal Heat Score.
Yeah, thanks, Angie, Shasta. Really always a pleasure to be with you. I think the last time we saw each other was at the Tribal Climate Health Adaptation Summit at OEHHA in November. So it's good to be back with you again and have some, really significant updates from our office in this tool that we have come out with a prototype of. Want to really emphasize that piece because we really just met our main goal was meeting our legislative mandate, which was to produce a first version of the tool by the end of last year. So we did that. This tool came out December 31st, and we're really just very much just starting to really spread the word, trying to raise awareness that it exists. And I can talk a little bit more about that. Is it okay if I share my screen, Angie? Yep. Okay, great. So I'm gonna do that. There we go. So this is a treat for you all for sure, because this is the first time we're sharing our brand new logo. This logo just came hot off the presses. Cal Heat's it's the one in the big one, the one that I made bigger than the other ones to kind of emphasize, that one. Anyway, we're happy that we have a logo and we don't have to just use the same old branding that we've been using forever. So I want to chat with you all about this first version of the tool that that myself, Felicia, Brooke, and Susanna, all on this call, work to develop. It's called Cal Heat Score, and the long form name is the California Community's Extreme Heat Scoring System. This tool, I mentioned it came out of legislation. It's not on this slide, but I just wanted to mention it. It came from original legislation called Assembly Bill 2238 that was passed in 2022, mandating the development of a statewide extreme heat scoring system for California. We know that extreme heat is a really deadly climate hazard. Awareness levels around extreme heat are quite low. Usually a lot of people treat a 95-degree day the same as a 115-degree day. It's all just a hot day. But actually, heat can really impact people drastically, even in lower heat days, depending on your activities and your health status and so on. Extreme heat impacts all Californians, but it really disproportionately impacts those most vulnerable: older adults, children, outdoor workers, those with a lack of access to sort of infrastructure or community resources. The best available climate science is telling us that this is a pattern that's set to continue. We found that January actually marked the hottest month globally on record just this past January around the world. And so I know it's in Northern California, it's cold and rainy, but trust me, the extreme heat is coming to California, and we're really trying to get ahead of that by getting this tool out there. Where this tool sort of came from that led to the legislation was from a Department of Insurance climate insurance working group that basically identified the need for a warning system like this in California. So a good way to think about this, it's very similar to existing hurricane or tornado ranking systems. The higher the number, the more intense, the more negative health impacts, even other costs not related to health, such as infrastructure, agricultural, and other impacts we expect to see based off of the level of intensity. The goal is to really increase awareness of extreme heat events, get people early warning so that they know an extreme heat event is coming to their community. We think this will ultimately reduce the amount of heat-related illnesses and deaths throughout the state. And that's the goal of Cal Heat Score, is to let people know extreme heat's coming, connect them to locally relevant resources, which I'll talk about in just a little bit, and to reduce the number of illnesses and deaths. Our goal with this tool at OEHHA, pretty consistent with our mission, is to create tools and resources and risk assessments to essentially warn people about this intersection between exposures and particular types of vulnerabilities to protect California's most vulnerable from these types of hazards. In this case, the hazard is extreme heat. So this tool is live. I mentioned it. I want to just show you a quick demonstration of it in action. And it is right here. So this tool's available right now. Maybe one of my colleagues can go ahead and link it in the chat while I'm running through it, if you want to play around with it yourself. So this is just go through the user experience really quickly on this tool. It's a mapping tool. You go ahead and check this little box right here and click OK, and it brings you to the main screen for Cal Heat Score. This is at the zip code level across California, and it updates every 24 hours. So you can see what the sort of extreme heat conditions are forecasted to be for today. And you can look 7 days in the future by clicking on any of these buttons here across the top to get a sense of what forecasted conditions are looking like. I'm going to go all the way out to Tuesday. Yeah, I think it's going to be pretty cold and rainy throughout most of California. So I hate to show you this really boring gray map, but 2 weeks ago, Cal Heat Score was showing some heat throughout several parts of the state. And, come back in about 6 weeks and lots of California is going to be popping up. On the left-hand side here of the mapping screen, there's some basic information on how to use the map, what's in the map. We also have a little legend here that basically shows color coding. So when we do see hotter days, you'll see parts of the state light up in these, more orange and magenta colors. I'm going to go ahead and just go to a location on the map by using the search tool right here and typing in Riverside, California, clicking on that, and zooming to zip codes in and around Riverside. I'm just going to scroll a little bit over here. And clicking on any one of these zip codes produces this sort of main data panel in the middle of the Cal Heat Score tool, showing this this dynamic infographic, as well as information about how many people are in the zip code. And then also, what's the forecasted max for the day, as well as some sort of historical weather information, like what's the record high and the average high. So that gives the user some sense of how today's heat conditions compared to historical averages. These tabs here in the middle, called profiles, allow you to get a sense of, what age sort of breakdowns are, as well as race and ethnicity breakdowns are in the zip code. And then this third tab has some indicators that could be relevant to extreme heat sort of awareness, or populations that could be impacted by extreme heat. Now, there are a ton more indicators than this that are relevant in this instance, but we wanted to just include a few here to allow people to get a sense of some data to go with the prototype, but really hear people's input on what else should be in this tool. So in this instance, we have information on, those without health insurance, those who are outdoor workers, and those who are linguistically isolated. So I talked a little bit earlier about, not only communicating risk of extreme heat, but also showing information about locally relevant resources. And that's another part of Cal Heat Score, sort of like, in a way, the obvious question as to what's next after you get an understanding of what heat risks are. So there's this tab here that I'm hovering over that says Cool Centers. If you click on it, it shows locations of cool centers. This data is maintained by local governments, right? So this probably Riverside County, or maybe nearby cities such as San Bernardino. And clicking on one shows the information on nearby cool centers that a person could access that are available to them. Now, we only have some of the data across California. We recognize fully that this is not a complete data set, but what we're trying to do here is, once again, start the conversation. Maybe we'll get input from another government that says, oh, we have cool center data we want on the map, or cool center data is actually not as important to us. We want community clinics to be mapped out on the map. We want this kind of input for Cal Heat Score. We want to understand in your community in California what kind of data should be on the map that helps you and your loved ones stay safe from extreme heat and are able to sort of access resources in your community. Sort of closing out the little website demo here. We have across the top some of these buttons I just want to direct your attention to. This button here goes to our Cal Heat Score website. So we have a full-blown website on Cal Heat Score that has information about the tool. We also have this guidance tab, right? So I think this was in Angie's introduction. Really, and I'll get into this just in a moment when I talk a little bit about nuts and bolts of Cal Heat Score. Cal Heat Score is really based on this unique combination. It's not just heat, but we're also considering emergency department data. So we're looking at what's this combination of, in the past, when it's gotten to a certain level of heat in a community, what are the ED visit spikes that we see at that level of heat? So in that sense, it's specific to different climatologies around California, whether you're in whether you're in Paula or Fresno or Oakland, the threshold is different of heat, but also it's specific to the health response, the emergency department data that we see as a result of that extreme heat. And that's what the Cal Heat Score rankings are fundamentally based on, and which is what makes it unique from something like a heat index from the National Weather Service, for example. It's based on health response. A couple of these other buttons are really just to show connect people to already existing resources that the state maintains. Some of this is from heatready.ca.gov, some basic infographics and things we wanted to just include as part of the tool that are here. We have a list of partners with logos. I'm going to skip that because that's not super exciting. And then also this feedback tab. So want to pitch it out to y'all. If you use the Cal Heat Score tool, please fill out our survey, because we want to know how easy is Cal Heat Score to navigate. How useful can this tool be to you? Do you see yourself using this tool this summer? So on and so forth. We also have a listserv link that we encourage y'all to sign up for if you've not already. Cool. So I'm actually, since we have a little bit of time, I'm going to pause because we also do have a smaller group and just see if I can answer any sort of clarifying questions. I am going to go into like nuts and bolts, like how the tool was built, as well as next steps, like what we're going to be doing in 2025 in the presentation. But if you have any questions, please let me know.
It looks like we do have a couple here in the chat. Oh, Shasta, did you want to say something here?
I was just nodding that, yes, we have stuff in the chat, but now that I'm talking, so I will just ask my question out loud. The values for what constitutes a high heat and high risk days, do they change for different geographic regions?
Yes. Yeah, they do change for different geographic regions. And we talked about federal data sources. We're using National Weather Service data, or NOAA data rather, forecasting data to get a sense of what those conditions and how they're different across every zip code in the state.
Great, thank you.
Sure.
Ben's asking, what is the forecast based upon?
Yeah, maybe sort of similar response. It's based on the National Digital Forecast Database maintained by NOAA, which is a 24-hour, it's actually more often than that, but we ingest the data every 24 hours into Cal Heat Score and use that for our forecasted data. The metric that we use specifically then is called apparent temperature, which is this combination of temperature and humidity.
And then let's see.
Thanks, Angie. Yeah, I can't see the chat, or I could, but I'd probably
Okay.
just
Oh,
myself
Shasta,
up.
don't worry. Shasta, did you already ask this one? Scores
Yes,
value?
yes.
Okay. All right. Sorry, I'm having weird scrolling issues. Oh, Isabel's asking, are you working with anyone from the Climate Change and Health Equity Branch Local Assistance Unit? Is that I think that's CDPH?
Yeah, I think we are. So CDPH is also called out in the bill for the creation of Cal Heat Score, and they're really designed to support ongoing development of Cal Heat Score, but also their role is specifically carved out to help make Cal Heat Score applicable at local levels. So we fully understand, like, we're creating this statewide screening tool, but CDPH's role is to say, like, okay, like, let's consult with local governments and local entities and communities and just get an understanding of how to make Cal Heat Score more locally relevant as well. So we're working with Elizabeth Rhodes, I believe, is working in the local assistance group. Yeah, we're working with her on Cal Heat Score.
This is Isabel here. Just chiming in on that note, there's also NEMSIS that has a dashboard. That's the National EMS right? There's one for California, and they're experimenting with their own sort of EMS 911 system surveillance data. I don't know if that is something that's incredibly useful to you. I mean, that's part of our emergency response plan, is that there are people internally that do syndromic surveillance for heat and track that. The one at that's ChemSys is a little bit more focused on like numbers of transports and stuff, less on
Mhm.
provider impressions or so forth. But I was wondering if you'd sort of have the opportunity to do that, any kind of that pre-hospital on the day surveillance, because that's sort of one of, we do that locally when heat is an issue. And we work with the weather service, and we love them and they love us, but we really can't give them, and they can't give us what we really want, which is how hot was it in the spot where the person was affected, as opposed, because like for the data we have when we get it, it's usually residents, right? But that's not necessarily where someone is exposed.
Yeah.
And just because I see you have, you have historical data, and I'm wondering, are you going to be able to do more frequent updates? Are you going to be working with syndromic surveillance? Is that even possible? It's not trivial, I know.
Yeah, all great questions. You're absolutely right. The measuring just ED visits is only one piece of the puzzle. And it really is our interest to more holistically capture the range of sort of health outcomes related to heat. It could be inpatient visits, it could be EMS. It could also be different data sources, right? Like not everyone's going to an ED. They might be going to a community clinic. So those are all things we're interested in that we want to sort of buff up CalHeat score with. Yeah, all really good suggestions. We are talking to our CDPH colleagues about syndromic surveillance. We want to be able to get these like larger sort of statewide data sets on that, and we understand that the progress around that has been probably a little bit slower than desired on a statewide basis. But I think of syndromic surveillance and this more real-time data as being a great validator of the CalHeat score tool to just help us sort of spot check and see like how well the tool is performing. So right now we are just looking at historical data, but are definitely, really interested in thinking about how to best use more real-time data. Cool.
Do you have more to go through, Walker? I do have some questions.
No, yeah, happy to answer them. I can also share these slides so we don't have to pop through all of them. Like I have nuts and bolts, but I did want to talk a little bit about some next steps. So just let me know what you want to do.
Well, a lot of times what we do in these meetings is sort of like, can we approach this tool as if we are a tribe and sort of see how it helps us answer certain questions? And it helps us get a little clear about like the use case. I think in this case, we're talking about it's the middle of summer. We think a heat wave's coming. We want to see how bad it is. We want to see our risk level. And then if it seems bad, then we have some resources we can use, right? We can go look for cooling centers and everything else. And it's in this like a 6-day window or maybe a week window, right? So a week out.
Yeah,
Okay,
that's
so
all right. That's all correct.
Short-term outlook, yeah. So let's pretend, we always like to pretend, I always like to pretend I'm Shasta. It's a fun game to play. If we pretend, let's pretend we're Paula, the Paula band. It's like, how would we approach the tool? They're concerned that it's going to be a hot week, and like look at it from what information might they be able to get out of this tool?
Sure, yeah, I'm happy to walk through that. I mean, I think my initial reaction is we want to hear from Paula as to what we can do to make the tool more useful, what additional information we can add. But I can walk through it like an exercise. I'm just going, to Paula. I guess I can just type in Paula's. There we go. So I just type it in the search bar. and that's going to take us to the zip code, which I will zoom out. It is a 92059. Click on the zip code. So that is one of the pieces, about Cal Heat Score. It's a sort of real time or near real time sort of awareness system. So this is not going to necessarily give you, at least in this prototype version, like all of the historical data. That is something we're working on, and we want to make that available. But it is going to tell you what does today look like in the coming 7 days, which unfortunately is all gray for the zip code. But yeah, so this is
Right. Normally, though, it would show color and it would show how much risk you're in, right? Based on all these factors in the background.
based on all these factors in the background. That's right. So, yeah, so we're at Paula, clicking on the zip code, scrolling through some of the tabs we walk through, getting an understanding of what today looks like, what the record high for the day looks like, breaking this down. And so, like, I think one great, one thing that we could work with, like today, is a validator as to how representative this race ethnicity breakdown is. So for this, it says for American Indian, Alaska Native, it says 24.4% for the zip. We don't know, and so it'd be great to hear from somebody who lives in this area, like whether or not that's accurate and if we could buff up that data source. So that's just one like little example of like, how well is the tool performing in a particular place.
That's interesting because I was playing with it myself since you gave the link, and thank you, Suzanne. I was going to ask if this is based on census data, and it is. So 24% for the Paula Reservation is low. It should be more like 99%. I mean, there are people who live here who are not Native American, but nevertheless. But when you're looking at the outline of the zip code goes way beyond the reservation, and then actually the south part of the reservation is in 92061. So that means that we have to do a little bit of work on our own to, oh, actually, no, it's not 92061. It's going to be whatever is below where it says Paula. There we go. Yeah. So yeah, but there's also, I was going to say, there's not a lot of people living on the south side of the reservation, but if we look at 92082, it's going to include a bunch of Valley Center. And so the white population increases dramatically there. And then I also wonder if there are issues of being able to choose more than one ethnicity, because most tribal folks are not just indigenous, they're also, potentially white or Hispanic heritage, even Black. So I don't know how the census does that, if you get to pick like sort of your main category, and then I don't know, because I'm just white, super boring. But so that would be an interesting thing to drill down into a little bit. But ultimately, for my purposes, I want to see what the heat estimates are and what the potential impacts are. I don't necessarily need to know the age profile, because I know that from my community.
Yeah, that makes total sense. Yeah.
And Xana here is bringing up a good point, and this conversation always comes up every time we have a conversation about a tool. It's just about the boundaries. So we might as well give our boilerplate boundary speech, which is federally recognized tribes often are not in the same boundary as one single census tract or zip code, and so it makes it really challenging for most tools. So no, like Paula is one. I think the branches at least 2 census tracts and looks like 2 zip codes. When we see the tools that are easiest for tribes to use are based on a tribal reservation boundary. Super hard to do. I get it. I think you actually have that capability in Cal Enviro Screen to be able to select tribal boundaries, at least for federally recognized tribal boundaries. That would be a huge benefit if it's possible.
That's great feedback. Yeah, that's exactly what we're looking for. So yeah, I'm sure my team is capturing that. Certainly something we could add the boundary data on here, and yeah, making that information available. I mean, I think it's important too, and it's that's the most relevant way to kind of represent what's, what's happening from on the reservation from a heat perspective.
But I would say that, and that's, yes, that's always good to be able to do that. And, for a community like Paula, for the most part, if we get the information for 92059, it's going to be what we need to plan for the future for this particular set of data for heat. It might be different for other things, like if we're trying to find information on hospital visits and we want to be specific to who from Paula might be having heat-related illness and goes to the hospital. Not that we don't care what happens to people outside reservation boundaries, but that's not useful for our planning. And then also for other tribes, I'm thinking of like say Hoopa and Yurok, places where they might have coastal parts of their reservation. This is up in like Humboldt, Del Norte, Trinity counties. And then they have mountain parts of their reservation. So it might be, cool and tolerable on the coast. And then you only have to go, I went to school at Humboldt, so I know what it was like. If you got cold in the fog in the coast, drive 20 minutes inland and it's 8 billion degrees. So, or maybe more like, 80, but it was hot.
Yeah.
And so that's going to matter too for planning for those reservations that have very different geographies within their boundaries.
I would say
100%.
too, so like the temperature difference isn't going to be that big between one zip code and another, but I think the tool itself is this algorithm, right, where it's calculating up from a variety of factors what the overall risk is, and those risk factors are certainly different for the tribe than they are even just right outside the tribe, right? So like a lot of those population sensitivity factors, the age might be different, it might have more elders or more young people, I don't know. Certainly the health related conditions that might, I don't know if you have any of those in there, but just there's certain chronic health conditions that are worse, right, in tribal communities and outside of them. And then, health insurance rate might be different. Like there's a lot of things that just are very different than their non-tribal neighbors. So I just feel like the risk level doesn't apply as well. It probably is not going to apply that well to the tribe. It won't be as meaningful.
Yeah, that's helpful. Brooke, do you have a comment?
Yeah, and just related, because the hospital data that we're using in the model takes into account the patient's zip code as opposed to the zip code of where the hospital is. I would imagine if the majority of tribe members live in this particular zip code, the one that ends in 59, that might be the best representation for the entire reservation, since the data coming from there is probably more representative. And whereas if you have much smaller number of people who live in a reservation on a different zip code, it might not be as applicable. So that I'm just like addressing, I guess, a limitation with having the zip code or the hospital or the patient data at the zip code level.
Oh, sorry. I just wanted to jump in and say there's another feature of health data that is, because we put together a health and well-being dashboard. So we look at a number of different conditions for all of the 18 tribes that are in our county that are federally recognized. And one of the things that we see pretty consistently is that rates calculated from our state data are substantially lower than the general population. And that has been noted, that's national as well. And we just see it over and over and over. And we know that, yeah, we don't quite, these are based on aggregated data of people, but it's just, there's a fair amount of underrepresentation when you're looking at even self-reported data. And we look at not non-Hispanic Native American. We look at anyone who says, I am Native American, and or either alone or in any combination of race and ethnicity. And we see this. We see a few things that in deaths where rates are, high, but overall it's just, I think probably the better data would be to work with the tribes and their data would probably give you more substantial correlations.
That's really interesting to hear. Would you say that the underreporting is due to the like less, like it's actually like reflecting reality, like they visit hospitals less often, or do you think it's like an artifact of the data that's being collected and they're just not being captured in the data?
I think they're not being captured or they're being misidentified.
Okay.
That's what I've heard from, when I have asked people that work, they work for tribal agencies, and it's well known that has been a problem with the deaths for many, many years, but you see it also in ED visits as well. And, everybody can't be, there may be people who are unconscious for more, but for some reason, that's perhaps not being captured. And over the years, the state has done a better job of making more categories to find people in. They can say this, but yeah, it's still an issue. And there may be, one study looked at what happened when you directly linked, say, birth death records, and you would get more, and you would see a better correlation that sort of matched what people were saying. This is what is a problem in our area, as opposed to what's represented. Now, certainly people might they might go to a clinic for the disease that needs treatment that other people might end up in the ED. But in our county, at least, they might be going into Imperial, or they might be going north, but there aren't any actual Indian Health Services EDs or hospitals within our county boundary, and our county boundary is pretty big. So they're unless someone is at a point where it would be faster to transport to an ED out of county, we are not going to see those. But even that is not hugely convincing. But we are the state, so we can't see all of that, right? There may be some of those answers if you are able to access the full state emergency department data. But that's just something that we've noticed, and we just, this is what we got, this is what we see. The counts are the counts, but when we're looking at rates, there's a disproportionately low. It's a low rate, so many low rates that we're kind of suspicious.
Great, thanks for
I know
sharing.
I'm sorry. Go ahead, Walker.
I know we're coming up on time. I just want to share this very last slide. Want to just talk to you all about some activities that we're undertaking. As I mentioned at the beginning of this presentation, we've launched the prototype, and we do have a lot of ideas on how we're going to improve upon this tool, but we really want to focus 2025 around getting the word out and getting input from Californians. So we're engaging in two key activities, I think, to start to tackle that. We had last Wednesday that Lori attended a sort of kickoff workshop. Now that we have a prototype of CalHeat Score out, that was a hybrid workshop, but we are in the very early stages of starting to plan out community in-person workshops throughout California to essentially have people test drive CalHeat Score and hear at a local level, how we should be improving upon the tool, how we should be communicating the tool, and how the tool, could be used. So that's one piece that's getting going. That more announcements will come on. The other part, we're working in contract with an academic to help us structure out some user cohorts for CalHeat Score to get more targeted input on the usefulness of the tool. The three cohorts that we are going to go with to get input from users are older adults, outdoor workers, and tribes. Essentially, we have not started recruiting for the cohorts just yet, but essentially what we're envisioning is that, the tribe cohort, for example, represents either tribal members or people who work for or represent tribes, and have those perspectives to offer to us. The cohorts are paid, for attendance, and probably the first meeting, you know, will be I don't know, end of May, early June. So that's just a little bit, and we're thinking about 20 to 30 people per cohort, if possible. If we get that many, that'd be awesome. So anyway, that's just a little bit of background. So if this is resonating at all with you, please do reach out to me, and I can give you more information about our process for moving along with that. We're continuing to do research and development, and then this is all leading towards, you know, an update to this prototype, a post prototype, essentially a 1.0 version. That's 2026, you know, at the earliest, and really this is our focus for 2025, and that's all I have. Thanks.
Walker, thank you so much for all this, and thanks everybody for your engagement. You all make a great tool. You're the best in the biz out there at making a good tool. So thank you so much for sharing that with us. I'm just grateful that there are still government agencies doing this work. And I think there's more for us to talk about. I do want to mention, like, our Tribal Climate Health Project just submitted a Cal EPA grant on extreme heat. And if we get it would be a really nice match with what you're talking about. In terms of the tribes that we're working with and folks that want to specifically focus on extreme heat. We're talking about giving them summary analyses. But what you're doing is really filling this gap of like a short-term outlook and like, hey, what do you do right now? Which is super cool. So we'll talk more about where else we can get you out in front of people. I also want to mention Colleen and I and Shasta are all working on the HPI extreme heat tool for tribes. And I think Colleen, what do you think? Are we going to demo that next time in 2 months? I think that'll be the right timing. Maybe.
Yeah, I think that would be great. That's a great, sorry to go off camera, but yeah, let's talk about doing that.
And then there might be some reason to share notes here in terms of like what indicators are we using versus this tool, and just kind of learning from each other. I think they could be friends because they do different things.
Only because of that, though.
Well, I think they're complementary, I guess is what I'm trying to say.
Yeah.
Anyways, I think that's it for today. Thanks again, Walker, and everybody from OEHHA. Be safe out there, guys. We'll meet again in 2 months, okay?
Thank you, everybody. Good to see you.
Thank you very much. See you later.
Bye.
Thank you.